So, my thanks to the speaker from Texas that preceded me and set me up so well. So now you all know who you're looking for with your eggs. And the only thing better that he could have done at that point was to also allude to the fact that he was not actually the person before lunch, but now I am. So you all had that expectation, and now I get to deliver the message that you got to listen to me speak first before you get to your food. So as Mr. Lamoglia said, I do have the honor and privilege of being the president of the Florida Society for Respiratory Care. And I've been a proud member of the board since around 2009 and been a respiratory therapist since 2004. I bring greetings from Northeast Florida in Jacksonville, Florida, where I reside currently as an inpatient care director at Ascension St. Vincent, Southside. And I love to be able to stress this because I think it's important that you all know that in Jacksonville, at my particular facility, I myself as a respiratory therapist am over about 130 plus nurses there. And where conversely, normally nurses are over us as respiratory therapists, we have an opportunity to be able to do those things. And so I just want to share that with people, not because I've done anything special, but because I believe that I've hit a milestone that somebody else can be able to hit. And not only hit that milestone, but exceed that milestone. So I just happen to be the fortunate person to be in the right place at the right time. But I do believe that there are many, many more opportunities ahead of us. I believe that the pandemic has shown us an opportunity, has presented us a number of opportunities for us to show people exactly what we're able to do, how we can challenge our norms, as I said in the student sections, as not only just clinicians, but as leaders and also decision makers in organizations. So I encourage you all to take that on. Traditionally, this would be our annual business meeting, but as a matter of order, our annual business meeting has transitioned to be a virtual meeting that will take place on June 30th. But that being said, we are going to go through a couple of things. And so one of the first things that I have to be able to do is I have the honor and privilege of being able to ask Ms. Kelly Curtis, our secretary, up to the podium. And Ms. Kelly is going to present to us information regarding our Dr. Ethel E. Johnson Scholarship Award.
Tony stole my Cinco de Mayo. I was going to say felicidades Cinco de Mayo. So we're going to have a big celebration. I welcome you all. It's my privilege to be here. I've been a member of the board for 25 years, and it doesn't seem possible as I stand here. I am very privileged to have the opportunity every year as chair of the scholarship committee to look at all of our applicants. So I want you to know we had 9 applicants this year for our Dr. Ethel E. Johnson Memorial Scholarship. Dr. Johnson, for those of you who don't know, was appointed by the governor as the consumer member of the Board of Respiratory Care, and her sister, those of you that know, Ernestine Mickey Thompson, who was on the FSRC board, was a delegate for us here in Florida, asked us to develop this memorial for her sister, Dr. Ethel E. Johnson. So I like to stress that to you. It's something that she was very passionate about. She was passionate about children and education, and by her volunteerism and appointment to that board, it brought great interest, of course, for respiratory therapy, and her sister wanted to share that with us. So that is how the scholarship was developed. John Wilgus asked me at the time. It was supposed to be John as president, and then I was going to follow him, was what our plan was. And then he said, how about you go first? So I went first, and then he had me develop the scholarship when he got to be president. So it was awesome. We all worked together. We have a great committee. I want to recognize all of you here that have helped, and we are so thrilled to see you seated there in person. But I want to thank Glenn for his commitment, ASG, our executive office. I want to thank Gina Ricard, who is a reviewer, great insight. And Gina will be our president-elect, so we're very excited about that. Also, Cheryl Barrett, who is our AARC delegate, Tony Lamoglia, who is our AARC delegate, are also on that committee and did reviews for me. And in the past, I have so many reviewers that are here and present. So I thank you. This is another one of my great people, Miss Misty Carlson. And what's great, yay, Misty. I want to thank them all for giving me this opportunity to share with you. So I am your FSRC secretary as well, and it's great. We've all wanted to have everybody back, and you're all here, so applauds to you. We survived COVID. People say, oh, you've been a respiratory therapist so long. What did you do? Well, I actually am a lead pulmonary function technologist, but guess what? Outpatient closed. So where did I work? Critical care. Okay, a lot of experience with nitric in very different systems over my years. So it did help me when we actually got to use it. We had some pretty sad outcomes, guys. I can't go there today. I want to go ahead and tell you about our winners. I think they're all winners, but these two are going to be awarded. The first one I'm going to speak to you about is going to be from Polk State College. I'm proudly here standing to announce that Shailendra Turner is receiving a Dr. Ethel E. Johnson Memorial Scholarship. Shailendra is receiving her PIN as a student of respiratory care and graduates tomorrow from Polk State University. So we're so happy for her. What we did, her program director, we had talked, and I call each of the recipients and I speak with the program director, and we got together and she said, you know, we're going to have this pinning. She's not going to miss the pinning. I know her. She won't miss it, and she won't be able to come. So Glenn came to the rescue, and he did a video, and he recognized her. So what she didn't know today was that Glenn recorded the video, and it will be presented at her pinning ceremony. So applauds to her. So there's her money, there's her certificate, and it's awesome. Thank you. And I don't want to leave her DCE out, Director of Clinical Education at Polk State College, and I apologize, I think I said Polk State University earlier. Polk State College is Jordan Emro. So she and Shanna Kent Smith are there, and they have an awesome program. First recipient ever from Polk State College. I know their program is ecstatic about this. Alrighty, this is our second nomination and winner this year. And I'm trying to say this right. I'm like anime, think of anime. Naomi Adabachi. I did have to practice, okay? Did I do okay? Yeah. This is Jacqueline. This is Jacqueline Soriano, and she's going to receive this award. So, say her name.
Okay. So on behalf of Naima Edabachi, I'm going to receive this award for her. She is a very hardworking student who is very dedicated in her studies and is very interested and is very encouraging in advancing the field of respiratory care and dedicating her time into mastery of each subject. So she is very deserving of this award, and we are all very proud of her. She represents the program very well.
Awesome. Thank you, Jacqueline. And these students, I just want to let you know, a shout out. So Nanny is 3.77 Q, satisfied all the requirements for the scholarship. So I'm thrilled that we can award that to her. And so on behalf of the FSRC, Dr. Ethel E. Johnson Memorial Scholarship Committee, we commend you and your co-classmate. Thank you very much for receiving it. Awesome. Thank you so much.
Thank you, Jacqueline.
And I'll be the one who will say, hey, if you have an extra pocket of change, we would love to have that donated to the scholarship committee. Our board always volunteers as well and pitched in, and I think we had $1,300 yesterday that went to scholarships, so I'm very proud of that. And I wanted to say one last thing about Shaledra. She is the class president. She is also the 2020 FSRC ambassador at Polk State College. So she actually attended our board meeting, and we met her one of our last boards when we were able to meet. So it is a privilege. Again, I thank you so much. I thank you for your attention and always being here. Reach out to the students. I know sometimes we speak to the choir, but I think we have to lead by example. We have to show our passion for what we do. And it's a great opportunity to mentor these students that are coming out because we need them. We grossly need them to be accepted and willing and be taught the correct way of doing things. Okay, do we have to fly by the seat of our pants some days? Yeah, we do. But we're great at that. We're respiratory therapists. We're critical thinkers. Okay, promote them, actually get them into better occupational positions as well as educational positions. Great. Thank you so much, Glenn. Thanks.
All right. Thank you, Kelly. And a special hand for Ms. Victoria Soriano for coming up here on the fly and in front of all of you being able to speak so eloquently about her colleague. I think she demonstrated something that we don't often get to do or maybe think to do, which is to recognize someone else. In that moment, she let us know at least that she saw that person. She saw that person for what she was, what she has ambitions to be able to do. And when we think about what we endeavor to do to help build our profession, to help redeem healthcare, right? Because in a lot of ways, healthcare needs some levels of redemption, at least internally. That's really what we need to be able to do, right? And so as a perfect segue to what I want to be able to do at this point, I just want to recognize the tremendous colleagues that I get a chance to work with on the Florida, for the board for the Florida Society for Respiratory Care. And if I could, if you are either a current or even a past board member, if you could, would you just stand for just a moment for me? Because I love recognizing people. Yes. To be able to recognize, admire, and see how these individuals are not only just fantastic clinicians that are dedicated to their craft, dedicated to growing themselves professionally, but also to be able to pour back into our profession so that individuals like myself could benefit from those things. I cannot tell you how much I appreciate those things. Earlier in the student section, I was encouraging our students to right now decide to become owners of our profession, okay? We all feel like we're owners in our craft, right? No one touches my ventilator or else, right? But we don't take ownership of our profession. We certainly take ownership of our feelings, right? Because I can tell you when I don't feel like I'm being respected. I can tell you when I think that I'm being overworked. But we don't take ownership of those things that create those emotions in us. The Florida Society for Respiratory Care is just that. It is your opportunity to take ownership. We talk about dues and all of those things, but what those are is they are investments. The 13 plus board members that I get a chance to work with, we are constantly thinking about a handful of different things. One is either how we can advance our profession and how we can dream and create and make those dreams reality. The other two is to make sure that individuals don't infringe on those things that we sometimes take for granted today. All these individuals have full-time jobs, responsibilities that sometimes supersede the 40 hours or 36 hours a week that they could be working, and yet they find time to think. For some of them, they don't sleep. That's what I firmly believe when I see some of the emails that come across, right? They're always constantly dreaming, thinking about what's next, and they deserve so much recognition. along those same veins, to be able to be in this role that I'm in is one that I was not fully prepared for when I took on this role. And part of that to blame is the result of past presidents that are here today, but most recently, our past president, Dr. Tom Berlin. He unfortunately made this job seem really, really easy. He not only is a brilliant clinician, a thought leader in our profession, but just very snazzy and very quick-witted to boot. And on top of that, he just articulates a vision for our profession that, if nothing else, encouraged me in every way, shape, or form. Unfortunately, over the course of the last 2 years, we took a little bit of a hiatus, right? Because we had nothing better to do than to fight this pandemic. And all along the while Dr. Berlin was inventing new ways on how we were going to deal with supply shortages, deal with staffing shortages, and all those things in his own organization, he led the FSRC. And I mean that he led the FSRC. It would have been easy for him to fall back and be like, oh, well, guys, I don't have anything for you today because we're all crazy and I haven't slept and you haven't slept. But every time I had an opportunity to have contact with him, he was thoughtful. He was intentional about those things that he shared. And unfortunately, over the course of the past 2 years, he didn't have the opportunity to be able to stand here and receive the level of recognition that he truly deserved. So although I would love to have been able to recognize him as our current president, it is my proud honor to be able to recognize Dr. Tom Berlin as our past president for the FSRC. And if I could have Dr. Berlin please come up here to be thoroughly embarrassed. It is my proud honor to be able to present this to Dr. Tom Berlin for his sacrifice and his commitment to our profession and to his commitment to never leaving this organization until, to never leaving this organization. So thank you. Thank you so much. Really, really appreciate it. Thank you. If you don't like to be embarrassed, don't be part of this board. It is all part and parcel with it. I just thought of something, just the contrast with Dr. Berlin between his humility at times and the tenacity that he brings when it's appropriate is what we all need to do in everything that we do, right? You walk up into a situation as a respiratory therapist, you do what you have to do, but at certain times, you bring that fire. Like I said, don't touch my ventilator. Right? So, in this presidential update, because it's not the formal business meeting, the only thing that I can leave you with is a hope that each of you will seriously consider taking ownership. And although, yes, I would love for you all to become members of the FSRC, I want you to be more than that. Because it's not money that we need. We need energy. We need hearts. We need emotions. We need that to be channeled into a place where we start doing things. I can tell you in my place, as I said earlier today, what motivated me to move into the space that I'm in today was because there were moments in my career where I felt a certain way about how other people or other things were impacting me, right? And like I said, I may be quiet about those emotions, but I felt them. I felt anger. I felt frustration. I felt apathy, all of those things. But then I decided that I wasn't going to, if things were going to continue to impact me, then I was going to start creating impact. I was going to choose to start impacting in my space. Whatever your career is, whatever place that you're in right now, every day you have some level of impact. We talk about it, at an individual organizational level, right? You can choose to be someone that has positive impact, or you can choose to create negative impact. You don't choose to not. One way or the other, you're having some level of impact. My encouragement to you today is to have impact in your space, in your life, in your career, in your sphere, whatever that looks like. I think if we all just start taking levels of ownership, we will see moments where you start seeing other people, because that's another way of taking ownership. Victoria showed us that today. She came up here as Kelly asked her to come up. Oh, Jacqueline Soriano. Yeah, sorry about that. I don't take ownership for knowing names. That much I can promise you. But she took ownership for that person. She had that person's back. It was such a beautiful illustration that I had nothing that was not set up in any way, shape, or form. Promise me that. Okay, all right, just making sure. See? And so that's my best message. And to that end, one of my favorite things, and maybe the only thing that really I feel like, or one of the things I feel like God has gifted me with, is just the opportunity to be able to talk with people and to just be interested in their stories. And one of the things that the FSRC endeavors to be able to do is to be able to collect people's stories, to be able to put them together, to be able to, in some way, be able to take a snapshot of who you all are. Because make no bones about it, you all are part of more than a generational event, right? The last 2 years was truthfully, from my perspective, a species-defining moment in how humanity could be able to endeavor to be able to dream in a situation where at times we felt like there was no hope. And so we have a little booth out there. There's a sign that says FSRC with our logo, and you can take pictures in front of it. But also behind there, there's a couple of microphones, and I'd love nothing more than to have some people come together, whether with me or 2 people, and we just want to capture words, right? We just want to hear your story. We want to hear where you're from and what you experienced. If you were put out of your work because outpatient procedures were cut off, if you were in the middle of turning patients, if you felt impact, if you felt what it was like to be able to literally from one moment to the other not be able to tell if this person was going to make it on almost a minute-by-minute basis for an entire 12-hour duration. We want to start capturing those things. Those are stories that I never want to forget, because that's going to drive me for everything that I have to do moving forward. So if you would allow me that pleasure, if nothing else, to be able to connect with me, I would love to be able to talk with you. And if there's anything that I or the board can do for you, please come let us know. This is your board, not our board. We are here to serve you. And I thank you very, very much from the bottom of my heart for that opportunity. With that being said, it's time to fiesta.